Shame!
The average age for bottom surgery is over 18 years old.
So
overwhelmingly.
Why would, I just don't understand why the, it's not penile inversion vaginoplasty. I don't know what it's called because Jazz didn't have a penis. What's the purpose of making the hole, the space? What's the purpose of that?
What's the operation is because it gives them, it affirms their gender through the process of having a similar genitalia to a cis woman.
So what's the purpose of it?
I just explained that.
So the purpose of it is just feeling, just emotion.
No, the purpose of it is part of affirming who they are through a surgery that makes them look and feel more like a version of a woman that they want to be. You don't have to. There's not a template. That's not the only version a woman can be. There's other versions of how a woman can be and look, but that's the version that she wanted.
So what I'm trying to understand is why create a permanent wound for the purpose of a man to have sex with in order to affirm the identity of someone who can't feel any of that?
Well, first off, I have no idea about the actual sensations that people experience after these kind of surgeries, but that's not my business. And the second thing would be, I don't believe it's a wound. I believe it's an operation to have a genital change. That's it. To describe it as a wound is just very crude.
But it's factually a wound, right? I'm trying to avoid the right calls it a mutilation or an abomination. I'm not saying that.
Well, it's still crude to just call it a wound. After it's healed, I'm sure there's no more wounds or scars or anything.
They have to dilate for the rest of their lives because it is a wound. Like, I'm being academic. I'm not trying to be insulting to anybody. The right calls it mutilation and abomination. The reason they have to use dilators for the rest of their lives is because it is factually a wound.
But you're asking me a question that I can't answer because I'm not this individual. I don't know why someone would want to get that surgery because I'm cis and I don't experience these kind of things. But if someone wants to, but Tim, if someone wants to and it makes them feel better and improves their quality of life, then why do we have to get in the way of that?
Well, can I interject here?
My position is for adults, I agree. And I had the argument with Tom Fitton. He said it should be banned outright. So I disagree.
But overwhelmingly, when you look at the data, when it happens to children, it improves their psychological distress. It removes and lowers suicidal ideation. It shows in the data that it helps them.
That's not true, man. So the studies you have here, the study you have here, the largest one. So first of all, as I mentioned, there have been no controlled randomized trial, but the largest study you cited there, the largest study that you cited there does not say what you think it says. The Stanford University one, it was 27,000 people who were surveyed in 2015, and then there were 2 analyses done of these studies by Jack Turbin, and he lumped data together and did a few manipulative things to get the results he wanted. But there's 2 very important things to mention, which is firstly, this study was based on convenience sampling. So they were speaking with people who were sent to them by LGBTQ advocacy groups and groups that they reached out to. So you're already not getting an unbiased population sample there. And then they were determining whether that person received puberty blockers and other such treatments or hadn't, but they didn't go over the reasons. In fact, the people who hadn't received puberty blockers or those kinds of treatments didn't receive them because they weren't allowed to. And one of the requirements for being able to receive that kind of treatment is some level of psychological stability, which means the people who weren't on puberty blockers in that study were more likely to be psychologically unstable, which we would expect to produce a higher suicide rate, but that wasn't controlled for. On top of that, the data actually shows that the men who are on estrogen were more likely to become suicidal. But what he ended up doing, that's true, what he ended up doing was lumping them together. So he said people on cross-sex hormones are less likely to commit suicide because according to the sample he had of women, that was true enough to overcompensate for the increased likelihood of suicidality in the men. And he just threw them all together as if a man taking estrogen is the same thing as a woman taking testosterone, and we could expect the same medical outcomes. So, and I'm saying that's bullshit.
So to respond to you, I do have a number of peer-reviewed studies related to this.
And if they're as good as that one, I'm telling you, they're trash.
Mental health outcomes in transgender non-binary youth receiving gender-affirming care. February 25th, 2022. This one shows kids who received puberty blockers and hormone therapy had 60% lower odds of moderate or severe depression, 73% lower odds of suicidality. Gender identity 5 years after social transition. This one is in the American Academy of Pediatrics, peer-reviewed, July 13th, 2022. Between 317 youth, they found 94% binary transgender stayed the same. Only 2.5% reverting as cisgender, 3.5% as non-binary trans. A UK 2019 study of 3,398 people who had gender-affirming care found that only 0.47% regretted it. Another one, the impacts of strong parental support for trans youth, found that parents who support trans youth, this was 433 participants, double-blind study, 93% reduction in reported suicides.
So
hold on, and I think we can all have the good faith that you did as much work fact-checking those studies as you did the one I just tore apart, but I didn't have time to go into every single bit of statistical information you would bring here.